many of you have had mental health issues in your family or those that you know? Raise your hands.
We owe it to all kids in Colorado to provide leadership, to provide resources, and to provide support.
Integrating behavioral health and traditional medical care, to me, is the most important issue.
With the lack of funding for mental health care, we ought to have three fingers pointing back at ourselves. Tabor is a big issue.
This is one of the few areas that I think that the state should be aggressively funding. I don't believe that mental health can be resolved with private insurance, basically because private insurance, it's not predictable mental health. Every patient needs a unique patient plan.
When folks ask, what is it going to cost to provide adequate mental health services to the state of Colorado? I think the deeper question is, what is it going to cost if we don't?
If we had mental health available in schools and access for the parents that would be easy and would be affordable, I think we could avoid getting kids to these crisis points.
Teachers do a lot of things. We've got to complement them with professionals in the school that can take the burden, take the responsibility for helping somebody find resources.
We need to work with our counties, with our municipalities, with our school districts to make sure that they have the appropriate resources, whether that's dollars, whether that's counselors, whether that's co-responders, to make sure we can reach out to these kids in times of crisis.
Between 10 and 24 years old, the #1 cause of death in Colorado is now suicide.
You have to actually provide high-quality training for all adults that work in schools about earlier intervention and identification. You never know which adult a child's going to pick in the building to be able to confide in.
We need better trained counselors. We need more counselors. Just simply having people available to do it.
We have to get to the root of the problem. Is it the digital age? Is it violence? I think we're looking at this in just a too narrow of a scope.
It's more than just government being involved. It's about a community understanding that they also need to recognize some of the symptoms.
We need to give parents the access and not just depend on the teachers in the schools.
Kids say they have no adults that they can talk to. If they have one coach, teacher, school counselor, pastor they can go to, makes a difference in their lives. So we need to do more of that.
As long as due process protections are in place, would you support gun violence restraining orders?
Yes.
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 I would.
Yes. Yes.
Yes.
I'm glad that there's now attention being made to this, treat this as a mental health disorder and disease more so than a crime.
We have to talk about supportive housing, making sure that the social determinants of health are integrated with a housing policy.
Right now, the average cost to incarcerate someone in the state of Colorado for a year is $40,000 a year. The average salary for a social worker in the city and county of Denver is $38,000 a year. So you could literally assign an individual caseworker to one person for an entire year for the same cost you could to incarcerate them, and I would bet you'll get a lot better outcomes with the second strategy.
Educating the public around alternative pain management techniques, also around giving more education to our doctors.
We have to hold our doctors more reliable on how they are taking care of their patients.
There are many ways, there are many solutions, but we have to be innovative and we have to use the housing that we have more effectively.
When we educate our communities about the importance of this, I think we will make an impact.